Welcome, Dr. Anita. Today we will talk about respiratory distress syndrome. What is respiratory distress syndrome? Respiratory distress syndrome, RDS, is a breathing problem that affects newborns that are born before 36 weeks of pregnancy. The earlier or more premature baby is born, the more likely the baby will develop RDS. Many babies with milder symptoms get better within 3 to 4 days. Those that are very premature, it takes them longer to recover. Now, what happens in respiratory distress syndrome? RDS happens when baby's lungs don't make enough of fatty substance called surfactant, or it doesn't work as it should. Surfactant is made in our lungs during the last few weeks of pregnancy. It is like a soap, like a film that is coating lungs and keeps them open. It helps those tiny air sacs in the lungs that are called alveoli to open more easily. These sacs are being filled with air when the baby breathes, when the baby takes first breath after birth. Surfactant also helps to keep those alveoli open when air leaves baby's lungs. When baby with RDS starts to breathe, many of the alveoli cave in and they cannot open. Oxygen cannot get into lungs and carbon dioxide cannot leave our body. Because there is not enough of that surfactant soap in baby's lungs are stiff. I could compare it to the situation when we try to blow air in the balloon and that balloon is stiff and it's hard to breathe that air in. In the same way, lungs are stiff and they cannot open up and they cannot fill with oxygen. What are the signs and symptoms of RDS, respiratory distress syndrome? Symptoms of RDS include fast breathing. Babies breathe much faster than we do, 40 to 60 times per minute, but in case of respiratory distress, they may breathe over 100 per minute. It's a noisy breathing. Those babies make that noise that we call grunting. It's a noise that babies make when they exhale air. Next symptoms, retractions, which is a tugging in of the muscles between the ribs or under the rib cage while babies are trying to breathe. And babies may have blue discoloration tint of the lips, nail beds, or skin from lack of oxygen, that it's called cyanosis. How do we treat respiratory distress syndrome? First thing, to help to prevent RDS, doctors can give steroid medication that it's called betamethasone to pregnant moms who are likely to deliver before 36 weeks of gestation. Steroids help baby's lungs to mature and to make more surfactant. They increase production of that surfactant soap in baby's lungs before baby is born. As in transient tachypnea of newborn, we have to provide those babies with first respiratory support, second nutritional support. What options do we have? First option, it's a mask that goes around baby's nose. It's called CPAP. It blows air with oxygen to baby's lungs, keeps them open. It supplies oxygen and prevents alveoli from collapsing. For the baby that continues to have signs and symptoms of respiratory distress, or they have trouble maintaining good oxygen level on that CPAP mask, they may need more support with the breathing and they have to be intubated and they have to be connected to the machine that is called ventilator. The baby will need intubation, so the doctor will put plastic breathing tube, baby's mouth, to their trachea, so breathing pipe. And babies with RDS often need treatment with surfactant. It's like medication that we do have and we give to babies' lungs. Many babies that are admitted to neonatal ICU with RDS get better within 3 to 4 days. Their lungs start to make surfactant on their own at that time. They will start to breathe easier. They will look more comfortable. They will need less and less oxygen. And they gradually can be weaned from the support, either CPAP or that machine that is called ventilator. But some babies, especially very premature babies, they need treatment for prolonged period of times, many days or even sometimes many weeks. What is worth to mention also when we talk about respiratory distress syndrome? Respiratory support with oxygen and ventilator helps newborn babies with respiratory distress. But long-term use of oxygen and ventilator can also damage those very fragile and premature babies' lungs. Some babies that are born very early and need oxygen and support with the ventilator for a long period of time, that can lead to condition that it's called bronchopulmonary dysplasia, also known as a chronic lung disease. If you have any questions about respiratory distress syndrome, please contact me. You can find my contact information on our website neonatologyforparents.com. Thank you.